Okay, I did my practice experience synthesis on the issue of a lack of access to mental health care in pediatric patients. Mental health care is defined as the condition of being sound mentally and emotionally that is characterized by the absence of mental illness and by adequate adjustment, especially as reflected in feeling comfortable about oneself, having positive feelings about others, and being able to meet the demands of daily life. Um, So, the American Academy of Pediatrics researched that approximately 70% of children and adolescents who are in need of treatment do not receive mental health services. Of those who seek treatment, only 1 in 5 children use mental health specialty services. For the families seek services, 40% to 50% terminate treatment prematurely because of a lack of access, lack of transportation, financial constraints, a shortage of mental health professionals, and the stigma related to mental health disorders. The need for primary care clinicians to treat children with emotional and behavioral disorders will only continue to increase in the future. This is the change model I used. It's Kurt Lewin's change model. There are 3 phases: the unfreeze, the change, or the moving phase, and the refreeze phase. Lewin's change model focused on 3 different stages, such as unfreezing, moving, and refreezing. In the unfreezing stage, a problem is identified and examined. Interventions are discussed and planned, and resources and motivations are assessed. In the next stage, the change process, or the moving process, also known as the moving process, interventions are implemented and change goals are set. Change is maintained through this phase, and all interventions are assessed and evaluated for effectiveness. In the first 2 phases, it is particularly important that all involved in the change process are effectively communicated with and that everyone knows their role in the change process in order for things to go smoothly. In Lewin's last phase, refreezing, changes are made, the changes and the goals have been met, and they are made permanent, and they become the new status quo. They're the new normal. So in the refreezing phase, goals have been met, and the issue at hand has ideally improved. So the first intervention that I have kind of researched for the change process is more diagnosing at primary care offices. So the first potential intervention and change within the healthcare system that could be made is a push for more mental health screenings for patients in their pediatrician's office, and more training for pediatricians to become comfortable with treating mental illness issues before a patient is able to be seen by a psychiatrist. So another potential suggestion is having mental health psychologists or therapists available at a pediatrician's office in order to assess and help a patient dealing with an acute mental issue. So having someone kind of there and available to, assess, give a second opinion, and talk to the child and the family to help figure out, what's going on. Another potential suggestion is having mental health, like alternative mental health services available at offices as well. The study that I researched in my paper, it took place at a primary care physician's office that screened for mental health illness, showed rapid and improved treatment in the population of patients who were screened and showed positive for depression. So basically, in this study, they did had a screening tool, and patients were screened for anxiety or depression, and they were treated and followed after that. So also, the study showed that a minority of patients were most at risk to not receive treatment for mental health disorders. And so why it's best for them to be properly assessed in the primary care. So the order of that is recommended is address the issue at the primary care doctor. The primary care to investigate any comorbidities, any health-related issues, begin treatment, and then refer to a psychiatric specialist. In conclusion, the study suggested that you start with a population who's displaying mental health issues, address those issues at the primary care, and assess for any health-related issues. Start treatment and then refer to a psychiatrist. Starting treatment as soon as possible is important and leads to better outcomes for patients, as many psychiatry offices have long wait times for their patients, which can lead to a delay in treatment. Community outreach is another intervention. So the company Walgreens started a new goal or platform for communities. So Walgreens' mental health platform aims to improve health outcomes through early screening and intervention, to heighten consumer awareness and reduce stigma associated with mental illness, and to connect with more people with clinical resources in their community who can help. So Walgreens has started doing depression screenings. They're being offered for customers, and Walgreens has expressed their goal to screen at least 3 million by the end of 2017. So Walgreens has launched a new mental health website in order to address the needs of more members of the communities. Walgreens is also beginning to launch a new program that provides behavioral telehealth and connects patients with therapists and psychiatrists via their computers. So the goal is to promote access and use of mental health resources. Next, so another intervention was school screenings. So assessing and treating children in the school setting and at youth and wellness after school programs for mental illness. So school-based mental health services would benefit all students, especially those at risk for a lack of access. But even those who don't have issues can still learn about, mental health hygiene and prevention. So high school students should have mandatory mental health screenings and health promotion programs for their students as a part of like a health class, as these students are most at risk for substance abuse and addiction as a means to cope with their issues. So in a study really addressed the relationship between adolescence and substance abuse and found that a significant relationship was found between substance abuse and students displaying psychiatric symptoms or issues. So another study I was able to find in my research talked about the availability of mental health services in schools and after-school programs, and peer advocates that participated in the program too. Students are more likely to stay in the program if they felt like they had a peer to support them, they felt more comfortable talking to them, and they felt like they could confide in them without getting in trouble as opposed to an adult. But the study concluded that youth with more access to peer advocates were more satisfied with the mental health services that were made available to them. So involving peers in mental health promotion allows patients to feel more comfortable and able to relate with their peers. The study emphasized the importance that peer advocates help engage youth and encourage them to be active with their mental health needs. So through all my research, I found that early intervention is the best intervention. Early intervention with mental health disorders can lead to greater outcomes for patients. The best venues for early intervention and mental health promotion are the pediatrician's office, primary care office, schools, after-school programs, and just within the general community. So this requires a team of mental health professionals, teachers, educational learners, public health officials, and nurses and physicians to design these programs and evaluate their effectiveness. The programs will also cost money, and mental health professionals in the community will need to fight for the importance of these issues and changes. So in application to Lumen's change model, for the first step known as unfreeze, I identified the problem and did research on the issue, and I concluded the possible interventions as mental health professionals in the schools and after-school programs, as well as screening tools and assessments in the pediatrician's office or primary care offices. The next step, known as the change phase, will begin by implementing these changes into the community and spreading awareness about the importance of these programs. The change process will remain until the programs have been implemented and should have success in the community and the mental health issues among the pediatric patients. The refreeze phase will not occur until a widespread mental health programs are successful and a normal part of school, after-school, community, and primary care or pediatrician programs. So what can we do? As a nurse, I thought about that. There's not much I can do right now from my platform. I wrote a letter to our congressman about just a lack of funding to mental health care services. I talked with some of the psychiatrists to see what they thought that work in the hospital that I do, and then just kind of reaching out to communities and seeing what programs they have and how that can be improved and what do they need specifically. One day I hope to maybe be a nurse practitioner and possibly focus in psychiatry. So hopefully I'll have, be able to make more changes that way. But during my clinical experience, Donicia and I went to the Women and Children's Shelter, and we talked to the kids about exercise, and we talked to them about mental health hygiene, and that was actually really fun, and that is definitely something that I'm interested in doing, is just helping promote mental health awareness in communities. Thank you for listening to my presentation.